Welcome back to the My Cancer, My Plan podcast. This is episode 3, and it's titled The Side Effects Nobody Talks About. Our guests today are Jim Haselmaier and Dr. Akanksha Mehta. Let's hear from them to talk about these side effects that nobody wants to discuss. Our next guest is Dr. Akanksha Mehta. Akanksha Mehta is a board-certified urologist and researcher at Winship Cancer Institute of Emory University, where she is part of the Cancer Prevention and Control Research Program. Dr. Mehta, welcome to the My Cancer, My Plan podcast. We're very pleased to have you.
Thank you so much. So excited to be here.
Dr. Mehta, my first question is quite blunt. Why don't men talk about this stuff?
I think there's a lot of stigma associated with decline in sexual function. For a lot of men, it's a threat to manhood. There's concern about what the locker room conversation will be, what their friends will think. I think for a lot of our male patients, we also see, this very strange pull between wanting to be thankful that they have completed their cancer treatment successfully and feeling like they do not deserve any more than a successful cancer-related outcome, that they really should not be worried about some of these survivorship effects, but they are so important. I mean, as we get better and better in terms of cancer detection, cancer control, cancer cure, we really, as a society, as a medical field, have to put more attention on how we care for our patients long term and for their quality of life after they have graduated from cancer care.
Is it true that some of the side effects that people experience when battling cancer, specifically male-specific cancers, never fully go away?
It is true. Some of these side effects remain with our patients forever. They include sexual side effects. They can include urinary side effects. They can include things like low testosterone and libido concerns long term, and they may never go away on their own. But we have a lot of treatment options to help patients with these side effects and to still optimize their quality of life, often approaching what it was prior to cancer treatment.
And what I hear from a lot of guys who are battling cancer, they talk about how they've got no energy. They've got literally, they can't even get off the sofa. They are just completely flatlined. What can men do to reclaim energy and their identity? You know, so much of our identity as a man comes from having high energy or, high libido, those types of things. What can we do as guys to restore that identity?
Yeah, I think a thoughtful discussion about why some of those side effects are happening is important. So sometimes it is because of the actual cancer, depending on where it is that you have that cancer. And I know we're going to talk a little bit about prostate cancer specifically today. So sometimes it's related to the treatment, whether you had surgery and are recovering from that, whether you had radiation, which can really knock the wind out of your sails, or whether you had some kind of systemic chemotherapy, hormone therapy. I mean, these treatments can do a number on your energy level. And then not to discount the psychological effects of going through a cancer diagnosis and treatment. I mean, that alone can sap the energy away from some of our patients. So, recognizing and accepting what it is that our patients are going through biologically, and then thinking about things that they can do on their own from a lifestyle perspective, staying healthy, eating healthy, making sure that they are participating in physical activities. And it may not be, the same person doing the same activities in the gym that they used to do prior to cancer treatment, but at least getting back to Perhaps it's a walking routine 3 times a week and you build up from there. Perhaps it's getting back into the social sports network with your friends and pick up basketball game or something else. Um, and then meeting with your physician and having a candid conversation about getting blood work, getting tested, sometimes starting on medication that can help you feel better as well.
We talk about prostate cancer. All these side effects kind of are very common for patients that are battling prostate cancer. But what would you say are normal side effects? What's manageable? What do you think that's not so manageable?
Yeah, I think the most commonly reported side effect from prostate cancer treatment are the sexual side effects. We hear that time and time again. It's also the side effect that lingers with most patients the longest, followed by urinary function effects, which are very problematic early after prostate cancer treatment. But for most patients, we see some recovery in that over time, first year or two. And then, depending on the type of prostate cancer treatment you have had, if hormone therapy or hormone deprivation therapy was part of that treatment, some of these hormonal side effects, hot flashes, the lethargy, the weight gain, the psychological like dysphoria and depression can be part of a patient's life for as long as they're on that hormone treatment and for some months beyond.
Okay, so what would be your professional guidance as how to manage these side effects and without the shame and the stigma that comes?
Yeah. I think most importantly, patients need to understand that these are part and parcel of like medical care, just like anything else. So these side effects, just as important from a medical standpoint as having high blood pressure or diabetes, and coming to your appointment with the same, understanding of the importance of these side effects is critical. The discussion really starts even when you're thinking about treatment or choosing your treatment options and you're speaking with your surgeon or your radiation oncologist in terms of what to expect afterwards. That's the ideal time to start talking about these, because your physician also needs to know that these are things that are important to you. Sometimes patients will underplay the importance of sexual function in their lives because they feel like their physicians don't want to hear it. We want to hear it. If we don't hear it from you, we don't know that it's important to you. So having that discussion early is critical. And if your surgeon or your radiation oncologist is not the person with all the knowledge about that, they will refer you to somebody like me or somebody who lives in a world where we do more of this kind of survivorship care management. There are definitely things you can learn to do even before you undergo treatment or as you embark upon treatment. What are the best nutritional things you can follow? What is the nutritional advice you can get? How do you manage to keep the weight off if you're going to go on some of these hormone deprivation therapies? How do you stay active even though you will be feeling less energetic than you did before you had surgery or before you had radiation? What are some of the physical therapy exercises that you can engage in to help return pelvic floor strength faster and maybe recover from some of those urinary side effects faster? What are ways to continue intimacy with your partner, even though you are dealing with some of the most severe sexual side effects in the first 2 or 3 months after prostate cancer treatment? I think it is a misconception to think that if patients cannot be sexually active, they, are doomed to that for the rest of their life. There are so many couples who continue to maintain good intimacy, good physical relationships throughout their cancer journey just by modifying their sexual repertoire, what they do with one another, how they talk about what they're going through. It is so important to be able to connect with your partner, frankly, about what you're going through. And these are things that you can learn to do any time in the cancer treatment phase, before, during, after. There's so many supportive resources that are available.
No question about that. There are tons of resources that are available out there. It's just up to us guys, the patients, to utilize them. Thank you, Dr. Mehta, for this valuable insight. How can people reach and or follow you?
Well, I'm available for appointments at Emory Healthcare, of course. But for patients, there is tremendous information available on the Emory Winship Cancer website. I also direct patients very commonly to the Sexual Medicine Society of North America website. They have a patient-facing page of that society called Sex Health Matters. And then another really valuable resource that we have played a role in shaping has been the Movember Foundation resources for our patients. Some of that work was done here at Emory with our team and has really led to some cutting edge guidelines on survivorship care for prostate cancer patients.
Jim Haselmaier is a 64-year-old. He's been retired for 9 years following a career in high tech. And in the fall of 2024, he went to the doctor because he was sick of getting up so much at night, expecting to walk out of the office with a prescription. He left instead with a referral to a urologist. One thing led to another. 2 months later, he was diagnosed with inoperable stage 4 metastatic prostate cancer. Wow, Jim, thank you for joining us today. What hit you the hardest that you weren't expecting?
First of all, thanks for having me, and thanks for all the work that you're doing to bring visibility to these issues and make people more aware of this struggle that people have. I think I could answer that question at kind of a couple of different levels. You know, first was getting an MRI before the biopsy that was very dramatic, is what I would say. It already showed some spread, and so that just sort of knocked me over. And then as each incremental test happened, when I expected them to say or to get an answer of, oh, okay, we understand what's going on now, let's take care of it, they'd say, that's not the result we were looking for. And we just kept doing more and more and more tests. And probably the hardest thing during that process was just not knowing where it was going to end and waiting for those tests to be done and waiting for the results to come back.
Right. Did you feel like you could talk to anyone about what you were going through?
I did. I mean, I'm fortunate to have a wife that's very supportive. We made the decision to start telling our family and friends pretty early. In fact, given the dramaticness of the MRI, I was virtually sure going into the biopsy that it was not only going to be cancerous, but it was going to be a pretty dramatic diagnosis. And so I was able to talk to family and friends before it was going on. They expressed a lot of concern. It helped me get through some of those uncertain times pretty well.
Yeah, and you mentioned to me when we spoke earlier that you were on hormone treatment, and I'm wondering what kind of side effects have you experienced through the therapy that you're going through right now? Is there anything you want to touch on that stands out?
That's been, in terms of treatment and getting into treatment, that has been the most challenging and dramatic thing that has happened. So in the fall of 2024, after all this unfolded, the diagnosis was very highly aggressive, Gleason score 9, prostate cancer that had metastasized to one regional lymph node and a few metastases in my ribs. That situation made surgery not a possibility. A lot of people have to go through the surgery versus radiation decision. That surgery decision was taken away from me because I knew it wasn't an option. So hormone therapy was started immediately. So that was in November of 2024. And then in the spring and summer of 2025, I went through 9 weeks of radiation. The radiation treatment If I think about unexpected side effects or challenges associated with doing radiation, I don't think I was prepared for, I'd call it the tedium of going through 9 weeks of radiation. It just got old after a while. You're going every weekday, 5 days a week, over and over and over again. And then I also wasn't prepared for all of the focus on liquids. Before each day's appointment, you had to focus on consuming a lot of liquid, and after the appointment, there was a lot of focus on getting rid of a lot of liquid, and that got kind of old. And then that migrated into trouble sleeping at night, getting up a lot, way more than normal, probably getting up twice as much as I was before the treatment. And I don't think, I knew it was going to happen kind of, but the degree to which it happened was surprising to me. And so that was unexpected. The fatigue I knew was going to happen, and it did. But hormone therapy has been impactful on a whole different level. There are kind of three areas where I knew that what ended up being on the surface level were going to be issues, but the depth that I would have to deal with them was very unexpected. Let's just take nutrition. The provider network I'm in graciously offers in their cancer center physical therapist, a nutritionist, a counselor, so you can get access to these resources if you need to. I went to the nutritionist and she basically said, eat well. Well, I'm kind of a guy that likes to get in and understand details of what's going on. And so I started doing my own research, and it's like, I need a lot of protein. I've got to be careful about carbs and not overeating. And I ended up going to a private nutritionist that's very highly respected to allow me to get to that next level of understanding. Exact same thing happened with exercise. They have a physical therapist. I went and saw them. They do tests to make sure you're not going off the rails. But it wasn't until I got a personal trainer and I joined a gym, and I'm going to the gym 5 to 6 days a week, before I could really make sure I was keeping my weight under control. I was adding muscle, because in case people don't know, weight gain and muscle loss and bone loss are huge risks with hormone therapy. And I've been able to counter those things through the exercise regimen. Big one,
right?
The big one that has been the most disruptive in my life has been mental health challenges. I heard a bit about mood swings.
There's a whole other side effect that most people that are it's simply overshadowed, and that's the mental health aspect, right?
Yeah. And that of all my treatment and everything I'm dealing with, there is no question that is the largest issue that I'm dealing with.
And was that something they told you about when you were first diagnosed and when you were first scheduled to go through this type of treatment? Was that something that was mentioned to you by the providers?
Yes, but they always called it mood swings. And when I hear mood swings, I was thinking I was going to be grumpy. And for me, it doesn't happen to everybody, but for me, it's basically a depression. Now, I'm told that it's not really depression because I didn't have depression before this started. But when I get in that mode, I can hardly do anything that day because everything feels heavy and down. And I had no indication that that's what they were referring to when they said a mood swing.
So when that happens, what do you do? What is something you do to break through that? Is it just time, or do you have a certain hack that you do in order to break through that depression?
It's both time and a hack. So I know I just have to get through it, and I just tell myself I'm not going to do anything that day. I go exercise. So exercising helps, but I reset my expectations for what I'm going to do that day. And I sort of give myself permission to say, I'm not going to accomplish anything today.
Right. Yep, absolutely. It's good to give yourself that break. What is something that you wish they told you about from the very beginning?
Well, I think because of the focus on the mental health issues, there are other mental health challenges that have come out of this as well. And so the degree that mental health could have been a problem to the degree that it has been for me, I think that would have helped me a lot. I'm much more susceptible to having my brain overstimulated, and I can handle much lower levels of brain stimulation, loud restaurants, being in groups of people, that kind of stuff. And if I go over the edge from a stimulation standpoint, it can take me 1 or 2 days to recover from it. And so I've had to learn to deal with that through trial and error and experimentation. And I didn't have any clue that could possibly be an issue for me.
So no Broncos games for you?
Definitely not. Definitely not. No concerts, hardly any restaurants.
Wow.
It's really significantly changed my social life.
Well, thank you, Jim, for being so candid and for your time. Tell viewers how they can connect with you.
Actually, you can go to jimhaselmaier.com. I have a website. It's just my name, run it all together and with no punctuation. There's a contact me link there. I'm more than happy to take emails or texts or phone calls if people want to connect with me.
All right. Well, thanks again, Jim.
Thank you. I appreciate all the work you're doing.